Hi, I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Today I'm answering a viewer question from MA, who asks, could you do a video on subclinical psychosis, and do you agree with people who say that psychosis is a spectrum and that a person can have some psychotic experience that doesn't rise to the level of a full-blown psychosis? Thanks, MA, for your question. Subclinical psychosis is a term that some researchers have used to describe psychotic symptoms in people who don't have a primary psychotic illness, or as a way to identify people who are prone to later get a psychotic illness. It's not really meant to describe a situation where you're just a little bit psychotic. Practically speaking, psychosis is binary. It's like a switch that's on or off. You either are or you're not, but you're not a little bit. That said, there is a concept of psychosis spectrum, which is different. So let me explain. Psychotic symptoms fall into 5 categories: hallucinations, delusions, disorganized thinking, which shows up as disorganized speech, abnormal or disorganized behavior, and negative symptoms. These are the 5 psychotic domains. I talk in more detail about what these domains are in other videos in my psychosis playlist. Schizophrenia is the granddaddy of psychotic disorders, and with it you have symptoms in at least 2 of the 5 domains. And many people with schizophrenia have more than 2. The 5th edition of the Diagnostic Manual created a category of disorders called schizophrenia spectrum disorders. And these are disorders that have symptoms in 1 or more of the domains as the main feature of the illness. So if you picture schizophrenia spectrum as a gradient, and at one end it's heavily loaded with psychotic symptoms and serious impairment, and the other end as being light on psychotic symptoms with less impairment, schizophrenia would be on the heavy end, and other conditions such as delusional disorder and schizotypal personality disorder would be on the other end. So the schizophrenia spectrum has more to do with how much psychosis you have. But you can have psychotic symptoms from a condition that is not on the schizophrenia spectrum. Depression and mania can cause you to have isolated psychotic experiences like hearing voices or being delusional. You can also have hallucinations if you're intoxicated from a drug or take a medication like prednisone or morphine. I had a procedure and got morphine for pain control, and after a few doses, I noticed that the walls were swaying in and out, and that was the end of the morphine for me. Some illnesses like lupus can affect your brain and cause psychotic experiences, but psychosis from these other conditions tend to be transient, meaning temporary, and they're on the light end of the psychosis gradient. Even if you have symptoms in 2 domains, the symptoms don't last like they do with the schizophrenia spectrum illness. An example of this is becoming severely depressed and psychotic. In that state, you may have delusions, like someone's trying to break into your home, and you may hear someone calling your name. That's 2 domains. But you can slip in and out of having those symptoms, and they're not a permanent part of your condition. As your depression improves, those symptoms go away. Because of this temporary come-and-go nature, psychotic depression is not a schizophrenia spectrum illness. People with borderline personality disorder can have transient psychotic episodes under stress. In fact, this is where the term borderline came from. It refers to a character organization that's on the border between neurotic and psychotic. Neurotic is a proneness to negative emotions like depression and anxiety. Psychotic organization is a proneness toward disorganized behavior that causes serious functional impairment. One more symptom that can feel like psychosis and make you think that maybe you're a little bit psychotic, and that is dissociation. Dissociation is a mental state where you feel disconnected from yourself or your environment. In this state, you can feel out of body, you can mentally check out when you get anxious, you can have trouble remembering events, or you can even have sensory experiences like hearing things or feeling or seeing things that aren't present at the time. These sensory experiences aren't considered psychosis because they're related to how your mind is retrieving memories. With hallucinations that come from a psychotic state, your brain is creating false information. But despite the differences in the biological origins, the dissociative experience can feel very similar to a psychotic episode. So you can think of dissociation as a cousin of psychosis. Dissociation is also considered a primitive defense mechanism that you can use to take unacceptable thoughts and impulses and tuck them away in your mind out of your awareness. And this is an automatic process that you can't control. If you do this a lot, you can have trouble feeling connected to reality and yourself, and you may have chunks of time that you can't account for. Feeling like this can be very distressing, but you're not considered to be psychotic. For more on severe dissociation, watch this video on dissociative identity disorder, or this video on is it ever normal to hear voices. Thanks for watching. See you next time.